We're with nurse Charlie Williams. She is a member of NEIDS, Nurses Educating on Illegal Drugs and Synthetics, right?
Mm-hmm.
Thank you so much for taking your time and letting us interview. So my first question for you is, what is the mission of Nurses Educating on Illegal Drugs and Synthetics?
Our mission for NEIDS is to go out and educate the public on the hazards that these drugs cause. A lot of people were unaware of how harsh these chemicals that were being put into the synthetic marijuana were. So they had no idea the repercussions of taking these drugs. So our mission and our goal is to get out and educate to the public how harmful these can be before they get into the hands of unsuspecting people who have no idea how bad these drugs can be. I mean, they can kill you, they can maim you, and it's just horrible. We've had lots of horrible patients coming in off this stuff.
Why is it that the vaping epidemic, as it's being called, such a big deal if the death toll is much lower than that of tobacco products?
Well, if you take into consideration that tobacco products have essentially been around for centuries, and we have so much more research backing tobacco from the early 1900s, now vaping has only been out for about 15 years total. And we are starting to see the repercussions of people vaping. It's still a brand new product. So I think that the death toll will continue to rise. The people getting cancer from vaping is already at a 5% increase than those of smoking cigarettes. So I think it's not that we don't have a high death toll yet, it's we don't know enough yet. The education is still coming out, and the scientists are still working on the research being done on these vaping products and how harmful it's really going to be on the epidemic, as you said, that we're seeing in the United States.
What were the pros of vaping when it was first being introduced versus the cons of it now?
The tobacco companies actually created vaping as an alternative to smoking cigarettes. Some of the pros that they offered were that it didn't make you smell like tobacco and the smell of cigarettes. You could do it indoors. You could do it in places where cigarettes were banned, and you could do it more conveniently because you wouldn't have to go outside and you also wouldn't have the smell. They were also saying that they were healthier for you than tobacco products, which we now know is false.
If you had a patient who was addicted to nicotine, what would you advise them to do?
If I had a patient who was addicted to nicotine, I would strongly encourage them to stop using, whether it's the vape products or cigarettes. It is going to be extremely hard because nicotine is a very addictive chemical. I would encourage them to use products that are out there for their benefit, like the nicotine patches or the nicotine gum, or to go visit a doctor and maybe get on a prescription that can lessen the cravings of that nicotine so that you can be successful in getting off those nicotine products.
What exactly happens to the victims of vaping versus the victims of smoking?
It all varies on the products you're using and how often you're using them. We have several patients that had only been using their vapes for a short amount of time, and now they have significant lung injury, versus you have a patient who's been smoking for 40 years and they do develop lung cancer. We're seeing that the vaping is actually causing the damage to happen much quicker than the traditional cigarettes and tobacco products.
What advice would you give to the family of someone who vapes?
Just like anything, whether it's vaping, using drugs, alcohol, if you want somebody to understand where you're coming from, you need to come from a place of love and respect. I love you, I respect you, but this is what I know about what you're doing, and this is what I'm worried about for you. Educate them as you've been educated, and let them know what the harmful things are, and that you're just worried about them because you love them, but always come out of a place of love and respect.
What advice would you give to people who vape?
So for the people who vape, I mean, you now know the education that's out there, what we're seeing, the harmful effects. You've gotten this far, and if you're okay, stop using the vape. Put it down. There are so many things out there right now that can educate you on why vaping is not a better alternative to cigarettes. And it's not your fault. You were lied to. The entire public was lied to when the tobacco products came out saying it was safer than cigarettes. Take the knowledge that we have now and just give them up. Get on a product that will help you get off the nicotine and safely get off of vaping and cigarettes completely.
Do you have any vaping-related stories that you could share with us?
We've had several incidences of vaping-related injuries in the lungs coming in through RER. We've also had several burn victims. The vaping products itself can explode. So we have had patients whose vapes exploded in their mouths or exploded in their pockets, causing severe damage and burns. We were also told about a girl through Facebook, and her vape had actually caused a skin disorder on her face, and her skin was basically sloughing off, and it was the bacteria that they linked back to the vape that she was using. So, from your lungs to your heart to your skin, anything can be affected by these vaping. I mean, there's not one good story I have from vaping.
Thank you.
Thank you.
In an effort to better understand the effects of vaping, scientists have done extensive testing on the e-liquids or juices that are used in most modern vapes. Some studies found that many of the brands contained harmful chemicals such as rat poison or trace amounts of cocaine or methamphetamine. Some juices were also found to contain bacteria that could also cause lethal infections and diseases. In addition to the health risk posed by the inhalation of the vapor, there have been many cases of injuries caused by the explosion of the vaping device. In these cases, the explosion is usually because the vaping device was not built in a regulated factory, or it was built using defective components.